The number of people who have contracted the highly contagious measles virus continues to rise. It can be deadly, especially for babies and young children.
And doctors say complications from the measles can have lasting effects. Investigative reporter Angelica Robinson explains in this 15 Finds Out follow-up.
Dirk and Tara, the CDC is reporting more than 800 confirmed cases of the measles so far this year. It's the highest number reported in the U.S. since 1994. Public health officials say the majority of the people who contracted the virus are unvaccinated. I talked with one woman who says she knows firsthand the impact that the measles can have. Before Pat Jackson even knew what the measles was, she dealt with the effects. She says it's taught her a valuable lesson in the importance of vaccinations. For Pat Jackson, getting around requires a little extra help. But after living most of her life without her vision, she's got it down to a science.
Everybody wants to be normal, so that was what I strived for.
Doctors considered her legally blind as a child, though she still could read large print. After having both eyes removed in her early 20s, she now uses Braille to read and write. Jackson was born in 1960, before the measles vaccine was developed. Her mother contracted the virus during her first trimester of pregnancy.
She knew how bad it could be, and she also knew that she could miscarry.
Back then, thousands were diagnosed with the measles each year. Hundreds died.
Nobody knew, including the doctor, nobody knew what to expect until I was born.
As a result, Jackson says she was born with congenital cataracts and a heart defect. Though doctors say cases like hers may be rare, studies show the measles is dangerous for pregnant women and babies alike.
If a mother gets infected with measles during pregnancy, she can have miscarriage, premature birth of the baby, or even low birth weight. Babies that become infected with measles, they are incredibly sick and definitely more at risk for dying.
Dr. Robin Schmucker is a pediatrician who specializes in infectious diseases. She says the measles is more than just a rash and a fever. Complications from the virus include pneumonia and swelling of the brain, which can result in a lifetime of developmental delays. She also says the measles is the most contagious disease known to doctors.
It's able to remain in rooms, especially for up to 2 hours after an infectious person has been in the room.
The measles was eradicated about 20 years ago.
Boom, puff, it was gone. This was a victory for science, and more importantly, a victory for public health.
Now there's a growing number of people who refuse to get vaccinated. Public health officials say that's causing the virus to make a fierce comeback. Dr. Tony Giaquinta is the president of the Indiana chapter of the American Academy of Pediatrics.
When we studied these vaccines, and we do study these vaccines, we study them ad nauseum, and we see populations and look at hundreds and thousands of children that are given these vaccines, we know that these vaccines are safe.
Pat Jackson says she and her siblings were vaccinated once the shots became available. She's hoping that her story will encourage others to do the same.
This is a deadly disease, life-altering disease, and it affects you your entire life. It's so important to get your shot.
According to the CDC, if you were born before 1957, doctors say you're likely immune to the measles. The measles vaccine was created in 1963, and in 1989, doctors recommended that children get 2 measles vaccines. If you've received a vaccination before 1991, you may want to check and see if you need a second vaccination. Angelica Robinson, WANE 15 News.